There are other conductive pathologies in addition to the most common otitis media. Collapsed ear canals. This is when they have very soft cartilaginous ear canals, and if you put heavy headsets on them, they'll collapse and you'll get a false conductive hearing loss. So you just have to be aware of that. If you're testing a child's ears, you don't want to put those heavy headsets on them. It's better to use insert earphones. There are ossicular abnormalities, which are problems with the tiny bones of the middle ear. There's Atresia and Microtia, which are birth defects that cause complete closure of the ear. So if you see with atresia, the ear canal never developed or the pinna. It's not simple. You can't just, drill a hole in. The middle ear is malformed. These children benefit from bone-anchored hearing aids, which we'll talk about. So microtia is also a small ear. It doesn't necessarily affect the ear canal. It might just look different, and they can use a prosthetic ear. Stenosis is when you have an abnormally small or narrow ear canal. Children with Down syndrome might have stenosis. And with stenosis, you just have to do a good job of keeping the ears clean from wax, which might build up. Cerumen is the fancy word for wax. We're supposed to have wax in our ears. It is supposed to protect our eardrum, and wax comes out naturally on its own. It's dangerous to use Q-tips. You have to be careful that you don't puncture the tympanic membrane. If when you're using a Q-tip it starts to hurt, that means you're going in too far. You really just want to clean the outer portion of your ear canal. If you do use a Q-tip, just be very careful. Don't use them on children. You can take it to a doctor that can get an ear, nose, and throat doctor that can remove the cerumen if it seems like there's a lot of cerumen buildup. Otitis Externa. This is an infection of the skin in the ear canal. So it's also known as swimmer's ear. So it's very painful, swelling, drainage. What you do is you put on a topical solution to help clear up the infection that's either bacterial or fungal. It doesn't necessarily cause a hearing loss, but it is painful. And it's a problem for children that wear hearing aids because if they get otitis externa and it's too uncomfortable to wear their hearing aids, then they're missing out on times for language development. So you see, the ear canal is all red, and it's painful. Perforated tympanic membrane, this is also very painful. So either caused in the eardrum by an infection or trauma. So if you're using a Q-tip and some sort of accident happens where the Q-tip gets punctured in through the ear canal, or if the child has a real severe ear infection that goes untreated and the fluid sort of bursts the tympanic membrane in the opposite direction out. Natural hearing can occur, but if it's very big, you might want to do a skin graft to cover it over to help it heal. And you could use, the surgeon would use muscle tissue or vein tissue because it's got a little bit more elasticity. Sometimes kids put stuff in their ears. I don't know why. I think my nephew had a piece of corn stuck in his ear that he had to get out. I remember an old professor at St. John's telling the story of she was driving her child, somewhere, and the baby was in the car seat, and she saw red dripping out of the ear, and she got all upset. She pulled over. She thought the child's ear was bleeding, and it turns out that the baby had put a red M&M in the ear that started melting. So who knows why kids do this, but if this does happen, you have to go and get it removed before it causes an infection. Cholesteatomoa is a growth of the skin in the middle ear. It could destroy the middle ear bones as it grows. It grows very quickly, so it needs to be removed surgically, and it needs to all be cleaned out. A mastoiditis, it's serious. It's an infection in the bone, the mastoid bone. You don't want any infections near your brain, absolutely not. So any sort of infection within a bone that's close to your brain, it has to get cleared out. It has to get scraped out or removed out. Sometimes mastoiditis occurs when there's a real bad ear infection and it spreads through the middle ear into the bone. I don't know if you guys remember when Ebola, everyone was so worried and crazy about the Ebola virus in Africa. And I'm not sure the exact statistic, but way more children die in Africa or all over the world every year from ear infections than from Ebola virus or other serious viruses. Believe it or not, ear infections, untreated ear infections, are very serious and they're a cause of death because it's an infection that can spread through the brain. And it's so easy to treat with antibiotics and PE tubes, but not every place has the access to medical care that we have. And, you know, we look at ear infections like no big deal, but other parts of the country, other parts of the world, it can be very serious.